Hi friends, it's Dr. Ladda here, and today we are going to deal with a topic from paper second, and this topic is for a long question, that is a question for 20 marks, and that is urinary bladder. So it is the topic from pelvis, rectum, urinary bladder, uterus are the topics which are likely to be asked in the examination for 20 mark questions. And these topics are easier compared to the abdominal topics, but very few students are writing about these topics. So now proceed with the urinary bladder. So urinary bladder, it is a storehouse for the urine. It is a storehouse for the urine. It is present in the pelvis and it is a muscular reservoir of the urine. So these are the 3 points. As it is a pelvic organ, it is present in the pelvis. It is made up of the muscles. So it is a muscular reservoir for what? For the urine. So these are the 3 points you are supposed to write in the introduction. Now the next feature or the next heading of this long question is features of the urinary bladder. So urinary bladder is, as we know, it is a muscular reservoir. Urinary bladder is a muscular reservoir. It is present in pelvis. Now where it is present? In the anterior aspect of the pelvis. It is present in the anterior part of the pelvic cavity and it has a particular capacity of contraction. It has a particular capacity. Due to this contraction only, it is able to empty the stored urine. So this contraction or this contractive capacity or contractive feature of the bladder is due to the muscles. Which are the muscles? Detrusor muscles. Is due to the detrusor muscles, and those detrusor muscles are arranged in whorls and spiral manner. So these detrusor muscles are helping the urinary bladder to get contracted while passing the urine. So these are 2 headings. One is intro, then features. Now you are supposed to write in this way, one by one, these headings and the description that will create a fine impression. Now we are proceeding with the next heading, and that heading is shape, size and position of the bladder. Shape, size and position of the bladder. Now consider bladder is empty. It has its different shape and size and position. And when it is full, it has its own or different to this shape, size and position. Now empty bladder, if bladder is empty, it lies absolutely in the pelvic cavity. Whereas the full bladder, it goes in the abdominal cavity. It goes in the abdominal cavity. So these size and shapes, they are vary. When the bladder is empty, it lies in the absolutely within the pelvic cavity. Whereas when it is filled with the urine, it goes in the abdominal cavity. So these are the positions, size, shape of the empty and full bladder. Now the next point is the features, external features. How it is looking? What are the external features of urinary bladder? The external features of urinary bladder also vary or also differ when bladder is empty and when bladder is full. So what are the external features of empty bladder? Now if bladder is empty, it is showing one apex. It is showing a base, or you can say the fundus. It is showing neck. Which one? Empty bladder. Empty bladder is showing apex. Empty bladder is showing base. Empty bladder is having neck. Empty bladder is having 3 surfaces. One is this and 2 these. 3 surfaces, and empty bladder is having 4 borders. Empty bladder is having 4 borders. Now my role is to describe each and every one. Now the apex of the empty bladder is directed forward, whereas the base of empty bladder is directed backward. Now the third one is neck. neck of the urinary bladder is lower and most fixed part. This is apex, this is base, and now this portion, it is a neck of urinary bladder. It is a lowest and most fixed part of the urinary bladder. Now, what is the exact position of the neck? The neck lie 3 to 4 centimeter. The neck lie 3 to 4 centimeter behind the lower part of pubic symphysis. Behind, now this is one pubic bone, this is second pubic bone. They unite together, and this union or junction of these two pubic bones is called as pubic symphysis. And behind 3 to 4 centimeter of this pubic symphysis, the neck of bladder lies. Now, this neck is pierced by internal urethral orifice. This neck is pierced by internal urethral orifice. So, the next one is surface, and we know the empty bladder has three surfaces. One is superior surface, second one is right infrolateral surface, superior surface, right inferolateral surface, and left inferolateral surface. This is superior, this is one right inferolateral, and this is one left inferolateral. So these are three surfaces of the urinary bladder. In the same sense, urinary bladder has four borders. Which urinary bladder? Empty urinary bladder has four borders. And which are those four borders? This one is lateral border, this one is lateral. So two lateral. Among the four empty borders of the empty your bladder, among four borders, two borders are lateral border. One border is anterior border and one border is posterior border. So anterior border, posterior border, and two lateral borders are these are the features of empty urinary bladder. So empty urinary bladder shows, just let's rewind a little bit. Empty urinary bladder shows apex, which is directed forward. Empty urinary bladder shows base, which is directed backward. Empty urinary bladder shows neck, which is the lower part and most fixed part of the urinary bladder, and this neck is pierced by internal urethric orifice. It has three surfaces. One surface is superior surface, second and third they are inferolateral surfaces. One is superior and two are inferolateral surfaces. And empty urinary bladder has four borders. One is anterior border, second one is posterior border, and two lateral borders. So these are the features of empty urinary bladder. Now, if bladder get full, all its dimension get changed, shape get changed. Now the full bladder shows apex, neck, and two surfaces. Apex, neck, and two surfaces means in the full bladder we are not having about the base. In the full bladder we are not having about the borders. Okay, 2 points from the empty border are missing here. So in the full bladder the apex is directed upwards towards the umbilicus. In the full bladder the apex is directed upwards towards the umbilicus. Whereas in the empty bladder the apex is directed forward. Now the neck of the bladder, it is in the same position because it is fixed part. So the neck of the full bladder is directed downwards. Neck of the full bladder is directed downwards, and the surface of the full bladder means full bladder has two surfaces. One is anterior surface and one is posterior surface. So full bladder has a apex which is directed towards the umbilicus, which is directed upward towards the umbilicus. Neck of the full bladder is directed downwards and it has two surfaces. One is anterior surface and one is posterior surface. So these are the features of empty and full bladder. So this is what about the few headings of urinary bladder, and now the remaining part of the urinary bladder, including its relations, the ligaments of urinary bladder, interior of the bladder, capacity and all these with the nerve supply and blood supply, we will talk in the next video. Thanks for watching.